to go to the nearest microscopic center or primary health care center or any health facility for that matter to be diagnosed, and once diagnosed to go in for treatment.
Okay, now you mentioned signs and symptoms. You said somebody coughs, somebody who has active TB, then it goes into the air. If your immunity is low, then you can come down with it also. But what are the signs?
Well, the major sign is coughing. If you see somebody coughing for upward of 2 weeks, the person has gone to the clinic or to any health facilities, taking all sorts of drugs, antibiotics, and the person is not improving. After 2 weeks, you should query TB and let the person go for diagnosis. Apart from coughing, the patients, some of them start losing weight, they get weak, there's loss of appetite, and at a very advanced stage, when the person coughs out sputum, the sputum might be blood stained. So these are some of the signs that you get, the general signs, but the major sign is coughing, and at the very acute stage, coughing out of blood.
Okay, and then the diagnosis itself?
The diagnosis is through what we call the microscope. They take the sputum, that is what the patient coughs out. They take a sample from the patient, there's a way they prepare it, and they look at it under the microscope, an instrument they call the microscope. And if you do that, if you're a trained personnel, a laboratory personnel, you'll be able to see the bacilli in that specimen you got from the patient. And by seeing the bacilli, you know that that person has been infected with TB, has active TB. And immediately you diagnose and see that, you refer the patient to the nearest dot center for the patient to take treatment.
Okay, after diagnosis, a patient is supposed to commence treatment immediately, and one of the very major challenge is the duration of the treatment. You find out that people go for the treatment, then along the way something happens, they can't continue, and then the issue of multi-drug resistant TB sets in.
Well, we have come a long way. Many years back, the duration of treatment of TB used to take about upwards of 12 months. You know, with newer drugs and more potent drugs being discovered, and you know, the treatment duration period dropped to 8 months. But now, there are newer combination of drugs that we are using in this country and have been used in other countries, whereby you can bring down the treatment rate to 6 months, duration treatment. But as I speak with you, there are lots of research and development going on. Newer drugs have been developed, because most of the drugs we are using for TB now were discovered some 20-30 years ago. So newer drugs have been developed, research and development is going on, and we have the promises, the hope that in no distant future we'll be able to have combinations of drugs that can cure TB in a shorter period of say 3 to 4 months. So we've come a long way. With regards to drug intake, patients that have been diagnosed and are placed on drugs should be encouraged. They should be counseled to be adherent to taking their drugs. They should take their drugs every day. And then, on the other hand, the government and the implementing partners should ensure that these drugs are available. We don't suffer any stock out of drugs, so that the patients don't break their drug intake.
That's another issue, stock out of drugs. People who are on treatment, they go to these dot centers. Sometimes they can't even get the drugs. How do you think the government can work in this area to make sure that treatment is not broken at any time?
We had the problem of stock out of drugs some time ago, but I can assure you that in the past 2 to 3 years, we've not had problems of stock out. Lots of donor partners. We have the Global Fund, we have the USAID, the CDC, the WHO. Lots of global international partners have come to support the government to provide these drugs. So for some time, we have not had stock out of drugs. We used to have that in the past. The area you should talk about, the area we should really focus about, is those who go to seek care for TB in the private sector. Most of the time, these private sector facilities don't have dots. So when the patients come, they end up prescribing the drugs for the patients. These patients now go to the pharmacy or to the chemist to buy these drugs. these drugs they buy off the counter might be fake. The patients might not have money, and the next time the drugs are finished to continue to buy these drugs, And then these are all areas that contribute to, some of this drug failure. But government is trying now to involve the private sector. The national program is trying to involve the private sector in TB control, especially with TB diagnosis and management. If we can do our best to expand the DOT centers to the private facilities, or even getting the private clinics involved, letting the doctors and the care providers in the private health facilities know the correct combination of drugs, the duration of drugs, and how to assist these patients to get good drugs, good quality drugs, and at the same time counsel them to take their drugs regularly. You have to take your drugs every day for the 6 months of treatment.
Okay, let's just go on a quick break, and when we come back, we'll be talking more about some of the centers that people with TB can go for treatment and, of course, preventive measures. To stay with us on Health Matters.
In every society, young people stand in the vanguard of sustained change. Creation, existence, history, and civilization are the very result of an exchange of ideas. The cultural forces, systems, and our very lives depend largely on an active negotiation of our shared reality. Nigeria's present and its future thus depends on her young and vibrant generation. The discourse for that reality begins here.
Join the ongoing conversation on Rubbing Minds every Sunday at 3 p.m. on Channels TV or on channelstv.com. Follow the conversation online on www.yniger.com/rubbing-minds and on Twitter @YNigerTV with the hashtag Rubbing Minds. With your host, Ebuka Obi Uchendu, a YTV production in conjunction with Channels Television.
You're watching Health Matters on Channels Television, and you can join us in this discussion. If you have any comments and a question, you can call us on the number now showing on your screen, or you tweet at us at yomi_otaigwe. Right, before we went on break, you were talking about treatment, being like 6 months, and some of the visuals or pictures were showing a family member also monitoring the patient taking the drugs. But sometimes, as I said earlier, this still doesn't work. What are the things that bring about the multi-drug resistant TB?
Well, let me just put it in a simplified way. TB, the primary TB that you get most often is curable. If the curable TB, if you don't manage it effectively with adequate combination of drugs, or that the patient doesn't take the drug religiously, or that the drug provider, the healthcare provider doesn't provide the right combination of drugs, the organism starts getting resistant to these drugs. And there are 4 major drugs you use. There are 2 phases of treatment. You treat with 4 drugs for the first 2 months, and you continue with 2 drugs for the next 4 months. So there are 2 very important drugs that you use for the treatment of TB, the isoniazid and the rifampicin. Once there's a break in drug intake, or you are using the the wrong combination of drugs, the patient is likely to develop resistance. And once it develops resistance to isoniazid and rifampicin, which are the 2 most potent drugs for the treatment of TB, you classify that patient as having multi-drug resistant TB.
And what's the implication of that?
The implication is that, 1, multi-drug resistant TB is a more serious case of TB. It takes a longer time to cure. It takes more expensive drugs to treat TB. To treat a case. We call them second-line drugs. What you call susceptible TB, you treat them with first-line drugs.
Okay.
The second-line drugs are expensive. The treatment for multi-drug resistant TB takes about 18 months. This is a
longer period.
Let
Doctor, please hold your thoughts. Let's be joined by this caller. Hello.
Hello, good afternoon.
Thank you so much.
Yeah, you're welcome. Yeah, my contribution to the program is to direct my question or my request to the professor online there, that what exactly is going to be done with the number of people that have to be